Fighting against injustice across Connecticut, Melissa in the Morning checks in with the Commission on Human Rights and Opportunities on WICC 600.
Good morning. We're welcoming to the show Jody Walker-Smith, and we're talking about Black Maternal Health Week, which is such an important topic. Jody, thank you so much for coming on. How are you?
Good morning, Melissa. I'm well, thanks. Thanks for having me back.
So, first of all, I'm doing fine. Thank you for asking. I wanted to talk about the significance of this week and really just in general. I can remember being pregnant with my son 4 years ago and hearing about that there are certain populations and even certain states where things like prenatal care are non-existent. And it's so... To me, it's so disturbing to think that we live in the United States and there are people who live in other states, let alone live in our own state, who don't get the same care that everyone else does. So could you talk about the reality of this, how real it is, but also the significance of this week?
Right. Disturbing is exactly the word, right? I mean, this week, Black Maternal Health Week, is a week devoted to, increasing awareness and community building around these issues. It was started about 5 years ago by an organization called Black Mamas Matter Alliance and was officially recognized by President Biden last year with Vice President Kamala Harris doing many events to foster understanding on this issue in conjunction with the presidential proclamation. The most important kind of statistic to keep in mind is that while 50% about of the population are women in the U.S., 44% of women in the U.S. are white, whereas 15% of women in the U.S. are Black. But despite this, Black women are 3 times more likely to die from a pregnancy-related cause than white women. And there are various factors that contribute to that.
Could you tell us?
We have to dig in deeper and not just stick with the statistics and say, wow, that's really unfortunate. Because these are choices. These are policy choices and implicit and explicit bias that contribute to this. Black mothers also suffer from postpartum depression and anxiety at higher rates and are less treated. And you pointed out the prenatal care. The reasons are really attributable to structural racism. The quality health care is less commonly accessible in majority Black neighborhoods due to historical devaluing of those areas. And then there's both explicit and implicit bias in medicine. You might have even heard last year, here's an example. Last year it came out that those pulse oximeter devices, the ones that everyone was using during the pandemic on their pointer finger.
The pulse ox, yeah.
Yeah, exactly. They test your oxygen level. They're less accurate in Black patients and others with darker skin pigmentation. The creators of the device assumed white or light-colored skin, and so they actually are significantly less accurate. Studies have shown, 3 times the likelihood of a serious medical issue not detected in Black patients than white patients using those. And that's just one example of the many ways that our diagnostic tools and the way that we operate in medicine can be really assuming a default patient that's white. And that can cause serious and sometimes fatal results for our Black pregnant people. There's also the chronic stress that racial discrimination and bias can cause. We all know that stress lives in our bodies, right? Whether it's work stress or, family stress, et cetera. Well, race discrimination and bias causes, chronic psychological stress, and that can contribute to conditions like hypertension, anemia, cardiovascular disease, and then those same health conditions can influence maternal health outcomes.
Wow. We're talking this morning to Jody Walker-Smith, and we're talking about Black Maternal Health Week. It's interesting, Jody, as I mentioned, this became very clear to me when I was pregnant with my son. But also, I have a very dear friend of mine who just had her second, God bless her, she and her husband are Black, and she was saying, her her sister-in-law passed during birth, and she had a very high traumatic birthing, and she and I had kind of connected on it because we had very similar situations. But I started doing some digging on this, and I think it's something like, and please don't quote me, but I think it's something like 77% of healthy births, live births, are because those women had prenatal care, good prenatal care, and that just struck me, that 3/4 of the live births that are as successful as they are, it's because the moms had good prenatal care. So I guess my question, you just threw a lot of information out at us. How do we improve that?
Sure.
How do we improve people getting access to that care? How do we improve that happening? Because I think this is a strong reality that I don't know, unless you're in that population, I don't think people realize it's that bad.
It is, yeah, exactly. And when it doesn't impact you personally, directly, sometimes you can just think of things as a sad issue as opposed to something you can do something about, right? And, whether this impacts you personally or not, we all can do something to, improve this and end these disparities. And one thing I'll just add quickly, to give a little more context, is that these disparities exist even when, factoring in for other things like educational level. You might have seen Serena Williams recently posted sharing her life-threatening birth experience to kind of shed light on it doesn't matter your socioeconomic status, your fame. Sometimes these statistics catch up just because of race. And so what we can do is educate ourselves, whether we're, in the medical community or we are, friends and family and activists and policymakers. We can educate ourselves. We can educate everyone in our circles. We can keep drawing attention to this and demand that there is an urgent need for solutions to end these disparities, and to not let this be a side conversation that doesn't get the focus and attention that the urgency demands. It also affects Black babies. Black babies in the U.S. die at 3 times the rate of white newborns. But studies have shown that when Black doctors cared for Black babies, their mortality rate was cut in half. So increasing pipelines for Black people to enter medical fields and having a diverse workforce in these medical communities can go a long way as well.
Yeah, so it's even beyond that. It's a trickle effect, attracting more diversity in the medical field. That's interesting. Right. That's really, really interesting. Jody Walker-Smith, if anybody wants to contact the Commission on Human Rights and Opportunities, wants to learn a little bit more about this, any suggestions for them?
Yes, thank you. To learn more about this issue, we actually posted about it today in honor of Black Maternal Health Week. Our CHRO Facebook account is found at CTCHRO, and our Instagram account is CT_CHRO. And then for more information about this particular issue, I would recommend checking out the CDC. There's information for all different whether you're a medical provider or a community organizer, there's a lot of helpful information on this.
Jody, we appreciate your time and for bringing this to our airwaves this morning. Thank you so much.
Thank you, Melissa. Have a